Good afternoon. Welcome to the City of Toronto COVID-19 media briefing for Wednesday, April 22nd, 2020. Joining us today, Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen Davila, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mr. Mayor.
Good afternoon. Thank you, Brad. Over these last 6 weeks, Toronto residents have done a great job staying at home as much as possible and keeping their distance from each other. We've urged people to do this based on Dr. Davila's advice so that we can stop the spread of COVID-19 and get through this pandemic as quickly as possible. We've done this to protect your health and the health of the city and to save as many lives as possible. But this has meant many residents have had to make sacrifices of many different kinds. You can't gather in the normal way in parks with your neighbors and enjoy a spring day together. You can't have a beer with your friends on a patio. You can't enjoy some of the many festivals and events that were rites of spring. And for quite some time in Toronto, one of those has been the cherry blossom bloom that has been one of the surest signs of spring in High Park and in other parts of the city, but the big show was at High Park. And I know how important this event has become over the years because of the thousands of people who go to High Park year in and year out to catch the sight of these beautiful trees. Last year, we celebrated the 60th anniversary of this enduring gift to the people of Toronto from the Japanese people. The ambassador to Canada gave this on behalf of the people of Tokyo, and it was given with great gratitude, and of course those trees have been added to and have stood the test of time. Earlier this week, you heard that we were and we are making progress in the fight against the spread of COVID-19, and that we have cause for cautious optimism. You also heard Dr. Davila say that the only way we can continue to make more progress is for everyone to continue to do their part by staying home and keeping their distance from each other. We know that maintaining physical distancing is simply not possible with the size of crowds that come through High Park every year to see the blossoms. For this reason, the city has made the difficult decision, based entirely on the advice of our public health professionals, to close the park for the duration of the bloom period for the health and safety of residents and park visitors. Just one more sacrifice that our community is making to defeat this virus. To encourage residents to stay home and stay safe, the city is working on a virtual walkthrough of the blossoming trees in High Park, which would be made available on a variety of different platforms. People will be able to experience this year's cherry blossom season in High Park through multiple live stream events and videos. More details will be announced soon, but we want people to be aware of the closure of the park now, well ahead of time. It is absolutely essential that we do not have large crowd scenes at High Park, crowd scenes which could lead to the spread of the COVID-19 virus and undo the good work that we collectively have done over these past few weeks. The closure of High Park will apply only during the cherry blossom pre-bloom and peak bloom time periods. High Park has already been closed to vehicular traffic for several weeks, and that will continue throughout the duration of the pandemic. This closure is not Toronto's alone. It follows on similar cherry blossom crowd control responses that have been implemented in Japan itself, in Korea, in Europe, and in Washington, D.C. Toronto is not alone in taking these measures, and it is for the same reason as in all of those other places, stopping the spread of the COVID-19 virus. So you know, as our officials prepared this plan, I asked whether a partial closure of High Park would be possible. There was much discussion of this by city staff, but it was determined that it wouldn't be feasible or practical and would likely further encourage people to gather in different parts of the park to catch a glimpse of the blossoms. This need to do this, and thus avoid what we know to be an annual crowd scene, is based on professional advice of our Medical Officer of Health, along with park staff, bylaw officials, and Toronto Police, who were closely consulted in the context of how best to achieve this goal. Believe me, I have no interest in closing a park, nor does any city official, nor does any member of City Council. But I do want to save lives, and I certainly do want to stop the spread of COVID-19 so that we can get back to cherry blossom festivals and many other kinds of events and just our normal lives in future years and in future weeks for that matter, and so that we can get on with restarting our entire city as soon as possible. I know some will be critical of this, as they have been with some of the previous physical distancing measures. But the fact is, borne out by the numbers, that thanks to your cooperation, these kinds of measures, these kinds of decisions are working. This is not a feel-good exercise. It is about difficult, sometimes unpopular decisions that are about keeping people healthy, saving lives, and getting this whole thing over with as soon as possible. So the dates for the closure are weather dependent, just like the blossoms themselves, and the actual dates of the closure will be announced closer to the time of the bloom, which usually takes place in late April or early May. The blossoms typically last between 4 and 10 days, and High Park will be closed while they're in bloom. I've asked and received assurances from our Parks General Manager, Janie Romoff, that they will be ready to open the park, to reopen the park as fast as they can when the bloom is over. Municipal bylaws give the General Manager of Parks, Forestry and Recreation the authority to close a park in the interest of public safety. Dr. Davila has made it clear to us, and I accept completely and unreservedly her advice, that this is a matter of public health and safety. Park staff and bylaw enforcement and police officers will be on hand to deal with the need for public information and assistance, and only if absolutely necessary, deal with compliance-related matters. Signage and barriers will be erected to make it very clear that the park is closed. Violations related to accessing a closed city park can result in a ticket carrying with it a fine. But I really hope, especially in light of the reason for the closure and given the abundant advance notice that we're giving, that people will in fact stay home, as our medical officer of health has advised repeatedly. And I do hope that not a single ticket will be issued. I would ask that residents who are turned away from the park, if they go there because perhaps they haven't heard the news, that they not take out their frustration on city employees. They are there to protect everyone's health and to help us stop the spread of the COVID-19 virus. I've also asked that park staff undertake a rigorous spring cleanup of High Park during the closure. This would have taken place in any event, but by taking advantage of the period of the closure to do it while still respecting physical distancing on the part of those employees, we will have the park in even better condition when it reopens and avoid a later disruption. Notwithstanding that we had the complete cooperation and support of the organizers, it has been heartbreaking, absolutely heartbreaking for me to tell you of the postponement of various of our most beloved events, like Pride and like the Caribbean Carnival and the Jazz Festival, and the list goes on. But if that's part of what it takes to get through this virus, to put it behind us, and to save lives and to save the health of the people of this city, then I'm down for doing this, and I hope that I will have your support. I hope we will all have your support as we carry out this difficult decision. I can assure you at the same time that we are doing everything we can to allow people to experience the blossoms online without risking the spread of COVID-19 and without risking their own health. And as I said earlier on, those details will be made available very shortly of how we will make sure people can enjoy this in a virtual manner as they've been enjoying many other things during the period of the pandemic. This closure involves a tremendous collaborative effort on the part of many city staff, including our Parks, Forestry and Recreation staff, our Municipal and Licensing Standards Group, the Toronto Police Service, the Indigenous Affairs Office, Transportation Services, and Strategic Communications, along with my office and the Office of the Local Councillor, Gord Perks. I would like to thank everyone, all of those people and many more who've been involved in this very difficult decision, but also in putting forward a plan that will work in the interests of protecting public health. I'd also like to thank the High Park Nature Centre, who suspended their Cherry Blossom Watch, and the Consulate General of Japan in Toronto, who supports this closure. They are promoting an origami project and the sharing of photos of the blooming trees as something that will hopefully for this year have to substitute for the real thing. These efforts are extremely helpful to the city at this time. We know that people really want to see the blossoms, especially this year, a year in which people have been cooped up in their own homes for weeks at a time now. But we also know this is not the right time to be gathering. We need everyone to continue to do their part and stay home. We know the cherry blossoms will bloom again next year, and I look forward to seeing them in person, as I've done many a year, with as many Toronto residents as can come out at that time a year from now. Now today we're also announcing the launch of the City of Toronto's Business TO Support Centre. This is something that's a very important initiative as well. The centre will provide virtual, one-on-one support to Toronto businesses during this unprecedented time for them and for our city. The city's new Business TO Support Centre will be available for all sectors, including the not-for-profit, creative, cultural, manufacturing, technology, retail, hospitality, tourism, Main Street businesses of all kinds, including consulting businesses. What the centre will do is have people that are there, experienced people who will advise over the phone and online how businesses can access the many government programs that have been brought forward to support them as a result of the pandemic. In addition to this virtual one-on-one support, the Business TO Support Centre will offer a weekly webinar series to provide information about all COVID-related initiatives and the requirements for applying for these programs. The Business TO Support Centre is available at toronto.ca/COVID-19BusinessTO. And I hope that you'll take advantage of the opportunity to see all the work that's been done to make it easier for you if you are a business that is disrupted by this pandemic so that you can get the help that you need. The launch of the Business TO Support Centre is part of the Mayor's Economic Support and Recovery Task Force short-term economic support and recovery plan for our businesses, and we're doing many things to help those businesses, including, as I mentioned the other day, the Digital Main Street project, which has been dramatically expanded, tripled, in fact, to help businesses get online and do business. And we've also had a number of initiatives we've undertaken together with the Toronto Regional Board of Trade. We know that people in all walks of life need help, and they need it right now. And your city government is doing everything that it can to make sure that these small businesses have that help. It is that collective effort that will get us all through this. I know this is a tremendously tough time. I know it is frustrating, and for many it is hard on their mental health and their general sense of well-being. But we will get through this, and we will come back stronger than ever thanks to your efforts. You are saving lives, literally saving lives, by staying at home. You are stopping the spread of COVID-19 by keeping your distance. This is an amazing city with amazing residents. Everything about it is amazing. It's admired around the world. We have been knocked down before, and we've come back stronger after those particular kinds of tragedies and other things that set us back. I know we will do that again because I believe in the people of Toronto and their strength and their determination and their solidarity in tough times. And on that note, I will call on our Medical Officer of Health, Dr. Eileen Davila, to give her report for today.
Thank you, Mayor Tory, and good afternoon, everyone. As of 12:30 this afternoon, there are 4,069 cases of COVID-19 in Toronto. This includes 3,685 confirmed cases and 384 probable cases. There are 290 people in hospital, 106 of whom are in intensive care units. I'm sad to report that we continue to see COVID-19 deaths in our community. There have been 210 people who have died of the virus in our city, and our thoughts are with everyone who has lost loved ones, as well as those who are recovering from this virus. I know that this has been a difficult time for all of us, myself included. I also know that we must keep moving. We must keep moving forward, one day at a time. We will get through this exceptionally difficult and challenging time by continuing to follow public health and physical distancing measures. As you have heard me say many times before, our current COVID-19 response measures are based in part on the experiences of other jurisdictions. We have seen the positive impact of these physical distancing measures in cities and countries all around the world, and we know that they are preventing further virus spread here in our community. In order to get to the point where we can go back to enjoying our city with our friends, our families, and our loved ones, we need to stay the course. It is our collective responsibility to protect our city and our essential workers who keep us all safe. Please be assured that when the time is right, we will begin easing some of our public health and physical distancing measures. In the meantime, we must continue to practice careful physical distancing, thorough hand washing, and we need to stay home, away from others, if we're sick. While the outbreak in our broader community is peaking, and it appears that this curve is flattening, COVID-19 cases and deaths continue to occur in our long-term care homes and in other congregate settings. And this is very concerning. In order to turn the tide in these settings, not only will they need to implement outbreak control measures, but we will also need to keep our public health measures in place throughout our community. At this time, we are not yet in a position to be easing up on public health measures on a large scale. We need to see better control over the virus in our community before we can take these steps. When the time comes, we will need to strike a delicate balance between easing up on measures for our broader community while keeping the residents of our long-term care homes and other vulnerable residents in our city safe. We will also need to make sure that people and organizations can effectively maintain physical distancing and other public health measures in our community. This will require significant work across the city, and it will require your commitment to making this work. I realize that you want to know when this will happen so we can all get back to work and get back to enjoying our city. Unfortunately, at this time, I don't yet know when this will be. But I will let you know directly when we are in this position and when we can begin to ease our public health and physical distancing measures. In the meantime, I want to thank our mayor and our city's leadership for their carefully measured and thoughtful approach to examining how we can safely reopen our city. I want to acknowledge also that I've been asked about COVID-19 data that shows us the impact of COVID-19 infection by race or by ethnicity. Without these types of data, we are not able to fully understand if this pandemic is disproportionately affecting certain people in our community and ways to address these potential inequities. My team is actively exploring ways to collect and analyze this information in our new data system. While we continue to manage a large volume of COVID-19 case and contact investigations, we are also committed to improving our own data collection tools to allow for the ability to gather this important data in order to identify and address potential health inequities. Reducing health inequities and improving the health status of all residents in our city is core to our work in public health. I will keep you informed on our work on stratifying COVID-19 data as we move forward. Lastly, I would like to acknowledge that today is Earth Day. I know that all of us would like to be outside enjoying our city, our parks, and our public spaces. But instead, we find ourselves cooped up at home and away from our regular support networks. This is stressful. There's no other way to put it. And we all process stress differently. For me, I try to find time each day to connect with my family, to get outside for a walk, or to listen to music. If you are feeling overwhelmed, please remember that there are many services available for you to connect with by phone and online. and information on these services can be found on our website. I ask you to remember, please remember, you are not alone. And at this time, I ask that you please continue to do your part to stay home, stay safe, and take care of each other. I'll now turn it over to Chief Pegg.
Excuse me. Good afternoon, and thank you, Dr. Davila. All aspects of EOC operations continue on a 24/7 basis to ensure that both critical and essential services are being provided without interruption. Further to my update yesterday, our personal protective equipment levels continue to remain stable. We are working with our city partners in technology services on the development of a comprehensive city-wide PPE management portal and dashboard in response to the COVID-19 pandemic. This is an incredible tool that has been built and launched to meet our needs during these unprecedented times. I would like to both thank and acknowledge our technology services team, along with our EOC and purchasing and materials management teams, for collaborating to develop this leading-edge tool. We expect to formally launch the tool later this week. Shortly after 8 o'clock last night, our fire, paramedic, and police service crews responded to a residential structure fire located at 371 Rathburn Road, just east of Highway 427 in Etobicoke. The fire was quickly controlled by our crews without spread to the neighboring homes. During search and rescue operations, one female occupant was located inside the residence and was immediately rescued and transferred to the care of Toronto paramedics. Unfortunately, I'm sad to report that we later received word that she passed away as a result of her injuries. First and foremost, I would like to extend my sincere condolences to the family, friends, and all those impacted by this tragic loss. As always, a comprehensive investigation into the origin, cause, and circumstances of the fire is now underway, in collaboration with Toronto Fire, Toronto Police, and the Ontario Office of the Fire Marshal. I would like to take this opportunity to remind everyone that the two leading causes of fire in Toronto are unattended cooking and careless smoking. Please ensure that you never leave your cooking unattended, and if you must smoke indoors, please do so safely and safely discard your smoker's materials. Never smoke in bed. Please take this opportunity to ensure that you have working smoke alarms on every level of your home, outside each sleeping area, and that you have tested them to ensure that they are in good working order. Also, please ensure that you have a working CO or carbon monoxide alarm in your home and that it has also been tested. As a city, we continue to provide the essential and critical services that our residents both need and rely on each and every day in Toronto. Please continue to make toronto.ca/COVID-19 your first source of information relating to city services and all COVID-19 related information. Thank you.
Thank you, Chief Pegg. Just a reminder, or not a reminder, but just to let reporters know on the line that both Paul Raftis and Marianne Bedard are on the line should you have questions. First question is to Camille Caramale from Global News. Camille?
Everyone, this is a question for Mayor Tory. How much could people be ticketed if they don't comply? Would it fall under the failing to comply with an emergency order ticket that costs $880?
It's actually,
regarding the Cherry Blossoms closure of High Park.
there is an offense provided for that's in the bylaws outside of emergency times that says that if you violate a decision to close a park that is rendered by the general manager of Parks, Forestry and Recreation, that you're liable to a set fine of $750. But depending on how it's proceeded with, it can go up, I think, as high as $5,000. But as I said, I very much hope that there will be no tickets issued because people will have lots of advance notice and they will understand the reasons for this very difficult decision are to try and protect health and save lives, and that they won't go to High Park to begin with during this time.
I know you said it's in the works, but Mississauga has sort of a virtual camera that's going to be facing their cherry blossoms. What's it going to look like for Toronto? Is it going to be just a 24/7 camera or a tour? Just a sense of what that virtual tour of High Park might look like.
Well, they're still working on finalizing it, but I gather it's going to have more than one camera, and we're going to try to have some other features, including some videos that will make this something that people can tune in a number of times on an ongoing basis during the bloom time and feel like they're there. That's the objective of this, and I hope it's going to be done, and I trust that people are working on doing it in a fashion that will, make people as happy as they can be when they can't go and see the blossoms in person.
Okay, thanks, Camille. We'll go now to Matt Bingley from Global News. Matt?
Hi, Dr. Davila. I just have a question about the collection of race-based data. How quickly would you like to actually see this data compiled, and when would you ideally like to see it released so we can see the findings?
So, Matt, as you know, we've just introduced a new information system in order to collect our data in a more efficient and effective manner at Toronto Public Health. So I know that the team is actively working on including and making sure that we're able to collect in this new system. And as you introduce new technology, there's always a few little challenges. So we're keeping our fingers crossed, and I know the team is working very, very hard to collect those data. When it comes to reporting data, I don't mind telling you that the data team at Toronto Public Health, and kudos to them, they've been doing a lot of work over the last several weeks, and it is quite complex work to be able to tease out data that people need to know around what's happening in our outbreak here in our city. But they're understandably extremely concerned about making sure that we put out good quality data. So I know that in addition to the work that needs to be done to the information system, once we've got it up and running and we're ensuring that we're collecting data appropriately, they will do a full quality assurance process to make sure that what we're putting out is correct, it's accurate, and that it comes with an interpretation and context so that the data are as useful as possible, both to us as public health practitioners and to our community.
And is this going to require more follow-ups of previous phone calls of people who may have been told to stay home if their symptoms weren't strong enough to require hospitalization?
I'm not certain yet, Matt. I will have to speak to the team specifically around what they would like to do. I know that right now the focus is on ensuring that the information system is ready and can appropriately capture that data in a manner that we can report effectively to the public, and so that we can get those data ourselves and use them to support our work in reducing health inequities.
Okay, thank you. We'll go to Tracy Tong now from CTV News. Tracy, go ahead.
Hi there. This question is for the mayor. Good afternoon, Mayor Tory. Wondering what you make of the Premier bringing in the military, and do you believe that Toronto requires that kind of assistance?
Well, I think that we talk about these different kinds of things all the time. We haven't discussed that specific matter. I will just say that in this case, I believe the military has been asked to come in to help with long-term care and some of the real tragic challenges that we've all collectively faced there. I will say in the case of our own long-term care residences, of which we have 10, we have redeployed public health professionals, nurses, and others. We have redeployed literally hundreds of city staff to help the hard-pressed staff to make sure that the residents are looked after in the best possible way. And so in our case, I think we've had the good fortune to be able to make arrangements to complement their efforts. And so it may well be that there is a need for some extra help from outside, from other sectors of that particular area, long-term care or otherwise, but at the moment, that is not something that has been discussed with us, nor is it a need the city has expressed or articulated to the provincial government, which was the government that asked for help from the Canadian Forces.
Okay, and I have a question for Dr. Davila, if I may. You have mentioned that it appears that we are reaching a peak, but we know that a peak could also mean a plateau. Do you see, or can you speak to this plateau and how long you think that may last?
So, Tracy, it's difficult to say, and you might recall from yesterday's remarks that we know that we've seen some leveling off in respect of the cases in our community, and that's why we appear to have some flattening of our curve, and that's why I indicated that we appear to be in the peak period. in our outbreak here in our community. But as it turns out, one only really understands where the peak is when you look at it after you've already passed that peak, and you can look at it in retrospect, if you will. So until we get beyond, that the actual peak period itself, we won't exactly know. It's just one of the things when it comes to outbreaks that with that particular milestone, where is the peak of the outbreak, you don't really fully understand where it is until after you've passed it.
Okay, thank you. We'll go to Jennifer Pagliaro now from the Toronto Star. Go ahead, Jen.
Hey there. For Mayor Tory, I know you've said that you're hoping it isn't necessary, but will there be extra officers deployed to High Park during the closure, just given the size of the park? Someone maybe not understanding that they still can't walk their dog, say, in the corner of the park.
I was honest enough in saying today that we did explore quite thoroughly the notion of having some sort of partial closure of the park, because there are people who go there to do other things than to see the blossoms. But it just didn't work out from the standpoint of trying to keep these crowd scenes from developing around the blossoms. The plan that has been put together, and one of the reasons it took a while to formulate it, was because there will be some deployment of police and park staff and bylaw people to simply make sure that people don't go where they're not supposed to go, and that we don't have the crowd scenes that we can't have for public health reasons. And so the answer is yes, and we had to make sure that that plan, which was developed in conjunction with the police and with the bylaw people and others, is something that is able to be carried out. The main purpose of it being just to try to inform and educate people, and hope that those who showed up because they hadn't heard the news would simply politely turn around, as Torontonians hopefully would do, and get on the subway and go back home and watch it on TV or online.
And for Dr. Davila, I wondered, you spoke about the 2 different outbreaks yesterday, and I know you said your team is working on a way to also present that data online. But I wonder if you can give us some idea of the outbreak that's happening in the congregate settings, how you would characterize what's happening there. Has it peaked the same as the general population, and how quickly are those cases increasing?
So, as you mentioned, Jennifer, there are in fact data, and I did mention that there are data available on our website. And if you look on our website, there is a section there that lists a number of graphs regarding the outbreak. And there is an opportunity, you can click on certain links and it will show you the entire outbreak, all the data put together. But it also separates community cases from those that are occurring within the context of outbreaks. So people can actually look and see the data for themselves and see them all together, and then separate it as community and outbreak settings. And as I've said many times before, within the context of long-term care homes, we see a large number of people together, most of whom are on the older end of the age spectrum and have existing chronic health conditions. So this makes that environment particularly susceptible to COVID-19 and severe impacts associated with COVID-19. You have older individuals who we know tend to have more severe manifestations of infection, and they're in a setting where it is extremely difficult to establish physical distancing because of the nature of care that those individuals require. That's why they're in those long-term care settings. So we have known that when COVID-19 enters those environments, it is rather difficult and does require great attention to detail and careful infection prevention and control practice, and as needed, outbreak control measures. So we're continuing to observe the situation. I would encourage people to look at the data that are available on our website, and I expect that things will change over time. We know that the province has announced a greater testing initiative in long-term care homes, and they are starting that now. So that may also change the picture as we understand it. So I would actually encourage people to keep an eye on our website.
Okay, go to Lauren Pelly now from the CBC. Lauren?
Hi, I just wanted to ask, this is probably for Mayor Tory, looking at Premier Ford's musings earlier today about opening parts of the economy around the May long weekend. He sort of clarified later he meant just a trickle, not the whole floodgates. What do you make of those comments, the fact that he did put some kind of time frame on when this could begin?
Well, I think he is optimistic and hopeful, as we all are. That includes me, as much as we sit here and say, and he does, and the medical officer of health does, and the Prime Minister does, that we're a long way from the day when we can, begin to do that, just because the numbers haven't yet turned down the way we need them to, that we're obviously making plans. We haven't attached any dates to the plans that we're making, simply because there is no ability to set a date, as Dr. Davila said herself earlier today. But I've been talking to him as recently as last night, and I think we're just in the midst of doing a lot of planning, because it's very complex planning that has to be done because of the complexity of a big city like ours and a big province like this. And I guess we'll all try and do what we can as soon as we can. He hadn't shared a particular date with me of May 24th or any other time, but you said they're musings, and lots of us muse about things that sometimes come to pass, sometimes not.
Question for you as well as Dr. Davila. When we look at the time frame on this, as you said, Dr. Davila, you can't put a time frame on it, but when that time comes, can you share a bit more on what that would look like? Do you start with small businesses? Do you leave stadiums and concert halls for months or a year down the line? Can you just walk me through a little bit about looking at this from an early stage, what a bit of that roadmap could be?
Well, I can certainly walk you through some high-level principles and considerations that we would be looking at. And as you've just heard Mayor Tory say, first and foremost, we would be looking at, so to what extent are we able to say that we have good control over the virus and its transmission in our community? That would have to be first and foremost. We would also have to be looking at things like, well, what is the capacity of the healthcare system in order to manage surges in COVID-19 activity, and as well to manage other health conditions, because this, of course, COVID-19, as important and as significant as it has been to our community and its health, it's certainly not the only condition that's out there. And we know that we need our healthcare system to respond to a broad range of issues. So those would be some sort of system considerations and community and disease transmission considerations that we would have to look at. As well, now looking at different activities, we would be looking for circumstances where, what activities might be able to be restored while still respecting physical distancing. We would be certainly trying to avoid crowding and congregations and large gatherings. But there may be certain businesses where, activity could be turned back on, but could be done in a way that it actually still allows for appropriate physical distancing to occur so as to prevent virus spread and transmission in our community. So those are just a few considerations. You can well imagine that there are many, many more that need to be thought through, but at least that gives you some high-level understanding of the kinds of things we'll be looking at, both from a public health perspective and frankly from a broader city perspective as well.
Okay, final question to Siobhan Morris from News Talk 1010. Siobhan?
Hi, my questions are for Mayor Tory. Mayor Tory, of course, all the focus has been on High Park since they have the greatest number of cherry blossom trees, but is there going to be any kind of measures that people will see to keep people away or discourage people from going to trees in other parts of the city at, say, Trinity Bellwoods or Centennial Park?
My information is that at Trinity Bellwoods, the park, the trees will be fenced off in some way or other, and I gather it's easier there to control the access to the trees through the fencing and so on than it is at a place like High Park, just given the nature of those two parks. And in other parks, I think at the moment we're saying to people, please, there are much smaller numbers of trees and so on. Please stay away and stay home and watch it on television, watch the High Park display on television. We will have bylaw and park staff watching those parks, but we don't see at this moment the need for as elaborate a plan as you have when you're trying to actually close a park that has been the main scene of crowd action over the last number of years. So Trinity Bellwoods fencing has been employed or will be employed to close those trees off. Other parks will be monitored. High Park will be closed.
And just, I'm going to continue to be a warm weather killjoy here, I guess. Are you doing any planning for, as the weather gets better, looking at other potential problem spots and thinking of beaches, which of course are closed, but I think people will be more inclined to want to go when it gets hotter, and maybe the island ferry docks as well, even though they're supposed to be for locals only.
We haven't turned our minds to sort of imagining another scenario that might exist when the weather gets really warm. Perhaps we've been spoiled by the fact it's been so cool so far in that context. But we're going to have to take a look, obviously, at a number of things, including events later on past the end of June, which we haven't yet fully examined and made decisions on, questions of summer camps, questions of the better weather in May and whether that affects in any way what we're doing with respect to the parks. As you know, the bylaw that provides for the physical spacing of people 2 meters apart will be reconsidered as to whether it will apply for an additional period of time once the City Council has its meeting at the end of this month. And so we'll take all these things one at a time. We thought about the island in the context of potential flooding, as you heard the Chief report on yesterday, but we hadn't really talked about whether the ferries would be impacted upon in any way, and we'll have to consider that because that will start to be something that will be of interest once the weather gets nicer.
All right, thank you very much, everybody. We will see you tomorrow at 3:45 p.m.